Hello, listeners. This is Janine
and Kristen
from Henrico Casa. You are listening to our podcast, Vigilant Voices. Living life every day. Hello, listeners. Thank you for being with us today.
As always, we'll be chatting about a topic relevant to the children in our lives.
And that's because we believe that it is important for all of us to know more about the challenges facing children and families in our community to ensure that no child faces continued abuse, neglect, or trauma.
Yes, and today's topic stemmed from a visual that actually caught my attention online. It was a Venn diagram.
Aha! Good little test, right? All right, so I haven't heard that term in ages, but as a quick reminder to our listeners, the Venn diagram are those two circles that overlap, and then they show you what is in common in that overlapping area, right?
Right,
okay.
Right.
That's my visual attempt.
Yes, that was a great explanation. And if you're not following that, listener, you can check out the diagram that's linked in our show notes so that you see what we're talking about. And this particular Venn diagram that I had seen and I'm linking to is comparing the symptoms of ADHD versus the symptoms resulting from trauma.
And this is a big topic that we see a lot. And for this particular topic, as Venn diagrams do, it very clearly highlights where there is overlap.
Yes.
So it shows the list of symptoms that are common between children with ADHD that I think oftentimes we want to then just go diagnose as.
Right.
But maybe it's not, and maybe it's trauma.
Correct. And, listener, why is this interesting to us? Because there are a lot of common symptoms.
Yes.
And knowing that helps us look at a child's behaviors and then kind of reference their background for more information.
Right. And as we've talked about a lot, it may mean that in their short life, they've been exposed to adverse childhood experiences, which we've called ACEs.
Right.
Or trauma.
Right. And when we reflect back and with that information, we can then hopefully better respond to this child's specific needs.
Exactly. So before we dive into some of this, because it's very interesting, Kristen and I always appreciate that you share a CASA case story. So do you have one for us today?
Of course I do.
Of course you do.
So the case that came to mind for this episode is that of a little girl, and I'm going to call her Susan.
Okay.
Susan grew up with custody split between her biological mom and her grandmother. And so both of these women were each struggling with mental health issues, and they both were involved in intimate partner violence. And so, poor Susan had more than her share of experiences with the police showing up at her home.
Right.
There were significant concerns for her ongoing safety. And so Susan was removed from her home and placed in a foster home. And it was around this time that Susan was first visited by her CASA advocate. And one of the things this advocate quickly learned about Susan was that she had recently been diagnosed with ADHD.
So I think now we know how this story ties into the topic that we're going to discuss. And and frankly, I mean, Susan is certainly not the only child we serve who has been diagnosed with ADHD. It is a fairly common issue or concern that comes up on, for many children, but certainly on our CASA cases. But I think it'll make sense when we get back to that sort of Venn diagram conversation.
Yes,
right?
yes. Okay, so big picture before we look at the diagram. Let's define ADHD and trauma for listeners.
So I'm sure that most of our listeners have heard ADHD. But what that stands for is Attention Deficit Hyperactivity Disorder. It's generally associated with like inability to focus, sometimes very impulsive behaviors, mood swings, and ADHD can significantly impact children in their academic performance and day-to-day functioning because it's an executive functioning sort of malfunction, if you will.
Right. And, thinking about the cases that we're on and the children we see, some specific symptoms of ADHD that we've seen are children being disorganized, excessive talking, maybe like losing track of their things.
And their thoughts, which then make them oftentimes unable to complete tasks that would seemingly be age appropriate, but they're not connecting those dots, right?
Right. That's a big one.
Yes.
And one more thing that I'd want to point out about ADHD is that it's a neurodevelopmental disorder. So it's often considered to be genetic. It's typically diagnosed during childhood, but because it's genetic and a disorder, like the symptoms can continue into adulthood.
Right. And by adulthood, many individuals with ADHD, they may have learned some coping skills or found a medication that's actually very helpful for them to manage those symptoms. But, it's oftentimes diagnosed and seen back in childhood.
Sure. And so then complex trauma is different from ADHD in that it's not genetic, right? It's the result of exposure to a traumatic event, a traumatic situation. Some of the things we see at CASA would be like exposure to domestic violence, physical neglect, various forms of child abuse, so on.
Right. This is the environmental piece.
Right.
And everyone then reacts to trauma differently. Right? So depending on what other experiences the child may have had in their life, well, maybe they can withstand some added stress of this type of trauma, or it might affect them significantly. And so behaviors we sometimes then see with the kids that we serve at CASA are isolation, disassociation, so they're disassociating, a lot of trouble building attachments to people. Maybe a need to control things and seem aggressive in that way.
And I mean, really, we could dive into each of these behaviors and see how they're directly related to that child experiencing a traumatic event or circumstance. And in addition to these behaviors, we often hear children say, they feel helpless, they're fearful, they feel like they can't control their anger or they're quick to anger.
Which also makes sense when you think about what these children have experienced.
For sure. And okay, so now that we've kind of explained both of these, I think we can understand and see the two separate issues, right? ADHD and complex trauma. So now let's refer back to that Venn diagram and where do they overlap?
Right. And there are actually a lot of symptoms that we sort of kind of alluded to that overlap. But, basically to us, what this means is when you see those things in children, okay, it could be either or. It could be due to a neurodevelopmental disorder of ADHD.
Right.
But maybe it's exposure to trauma.
Or honestly, both.
Sure.
Because a child that has ADHD can also be exposed to trauma. And really, some would say that they could be more likely to experience trauma because studies show that children with disabilities are at a higher risk of being abused and neglected.
That's very true. And so some of the areas of overlap in children's symptoms for ADHD or trauma include being restless or overly forgetful. Maybe the child doesn't seem to listen.
They may have difficulty sleeping or difficulty concentrating at school.
Low tolerance for frustration.
And that's a great example because that's where the overlapping symptoms start to get complicated, right? Does my child have a low tolerance for frustration because they're always struggling to follow instructions due to their ADHD, right? They're truly frustrated. That frustration is always brewing. Or does my child have a low tolerance for frustration because they've experienced something horrible with big emotions and they can't process that additional stress or strain.
They don't know how to. And I think maybe we can once again pause to say that, neither Kristen nor I are medical or mental health experts, but we've seen a lot of this. And we've studied a lot of this in many ways to make sure that we're informed. But really, we hope that you see where we're going from the perspective that a child can have feelings or behaviors that could be symptoms of two totally different things. That would then also mean that they should be treated in two very different ways.
Or again, maybe both need to be treated.
Exactly. So where do we go then with this information?
Well, like anything, I think knowing makes us better equipped, right? So hopefully we pay a little more attention to these types of behaviors. And when we notice them, we spend some time trying to see where a child's symptoms fall. You know, are they more on the ADHD side of the diagram? Are they more on the trauma side of the diagram?
And this really is important because we do know that our children in foster care are often misdiagnosed with ADHD when it really is all of the trauma.
Right.
And, you know, what we get to do in our role at CASA is taking the time to build that relationship with the child to better understand more about their childhood, their history. And, you know, I think that allows us to sort of informally gauge if they've experienced trauma, how significant was it? Was it frequent? And I think having some of that information in the back of our minds helps us respond to them and to ensure they're not being overly or wrongly medicated.
Sure. And if a child is exhibiting these symptoms because of trauma, we should then be responding in a trauma-informed way.
Exactly. So, listener, we've talked about this before, but what we mean when we say responding in a trauma-informed way means we can empathize with them. We can give them a sense of control over things such as a choice that they want to make, but then really try to focus it on their strengths.
Right, because the goal for a child who has experienced trauma is to help them build resiliency. They need stability and consistency and predictable relationships in their life.
And ADHD seems to be more readily defined and diagnosed than trauma, as I've kind of alluded to some examples. But if you don't think that ADHD is the right diagnosis, well, speak up, advocate, you know, pursue other options and treatments, right?
Yeah. And that brings us right back to Susan in our CASA case story. When her advocate met her, she was living in a foster home and, again, had recently been diagnosed with ADHD. And that was because of symptoms she was exhibiting, like being easily distracted and not listening at school. But over time, Susan's advocate started to wonder if her distraction was really related to the trauma that Susan had experienced. You know, her distraction seemed more like a hypervigilance of sorts. You know, she was always like wondering if she was safe and looking around to see what might possibly happen next. You know, would the police be coming? Like that sort of thing.
And that's not really ADHD.
Right.
And that's just a whole lot for this little girl to be worrying about.
Yes. And all those worries made sense, though, based on what she lived through,
right?
Absolutely. Susan's advocate recommended that she start counseling, which she did. And over time, as that therapy progressed, she was weaned off her ADHD medication. And so for Susan, the counseling turned out to be more effective as a treatment to her symptoms of trauma, not symptoms of ADHD.
And I love that. Because now we're at least actually getting down to the core issue. And so in order to best help the children in our lives, you know, we need to make sure that we are truly responding to and treating the right things.
Right. Which, again, can be a challenge because trauma does rear its head in so many different ways and honestly confusing behaviors.
Absolutely. So I think really, you know, we always end our episodes with a call to action. So I think maybe today it's really just to kind of go back and familiarize ourselves or maybe refamiliarize ourselves with the symptoms of trauma. So we do have the Venn diagram in the show notes that kind of initiated this whole conversation that I think is really clear. And so just keep it in mind when you interact with the children in your life.
Yeah. This is just another area where that saying is true, that when we know better, we can do better for the kids in our life.
Absolutely.
Thank you for listening to Vigilant Voices, Henrico Casa's new podcast. We have a vision for all children to live in safe, healthy homes. You can help us make that happen. Tell a friend about our podcast and find us on social media.
I believe in the better days.